Hi everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. You are watching the Need to Know show. For today's episode, we're going to talk about the Goldilocks theory and kind of give you an idea of what this theory is and what does it mean for you and your knee joint and your recovery from knee replacement surgery. So, Goldilocks, of course, a quick summary. So, it's all about she goes into the house and she finds the different things. And so, for example, the bed, she goes to the pop-pop's bed, the father's bed, and it's too hard. She goes to the mother's bed, it's too soft. She goes to the baby bear's bed, and it's just right. And this same idea happens with the porridge, with the food, and some other things. But the idea is that the one thing is too hard, the one thing's too soft, the other one's just right. The porridge father bear's is too hot, the mother's is too cold, the baby bear's porridge is just right. So the idea is, let's think about this in knee replacement surgery, or let's think about this in joint pain. So first idea is when it comes to your activity level, physical activity and exercise. So if you're someone who is on the far end of the spectrum where you do very high volume, very high intensity, very high frequency of physical activity, whatever that may be, maybe that's your occupation, maybe that's your training, running, high impact sports and activities, whatever that may be, you are at a higher risk for developing joint pain, for developing knee pain. And then when you're out from having knee replacement surgery, if you do these activities, these high impact activities, these stressful activities in a high enough frequency and volume, you're probably going to increase your risk of having a revision surgery, decreased longevity of your knee replacement. On the other side of the spectrum is the sedentary person, the person who really doesn't do much of anything. You don't exercise regularly, don't regularly have physical activity, don't really work out that much or exercise. And this person, same as the person on the other end of the spectrum, has very high risk of higher risk of developing joint pain and knee pain. They're probably at a higher risk for needing revisions or having a poor outcome from knee replacement surgery or feeling of instability from after knee replacement surgery. There have risks as well. Then you have kind of this middle zone, this moderate intensity. So this is someone who you regularly and consistently perform activity. You kind of do it at a moderate intensity, a moderate level of activity. You don't overdo it where you train every day and you stress the body super hard and you do very high intensity and volumes and frequency of exercise. You're kind of, you do it casually, you do it moderately to manage and maintain your health and your strength, your mobility. And you don't fall on the other end of the spectrum. You're consistent, you exercise, you make it part of your day and part of your routine to be physically active. This person is kind of in this sweet spot. They're in that Goldilocks position of just right. This person is probably going to have the lowest risk of developing knee pain and joint pain, all else considered. They're at a better spot after knee replacement surgery because you're providing that exercise, that physical activity and stress. You're building muscle strength, you're building mobility, you're building bone and joint health and bone density, maintaining bone density. So you're probably at a much lower risk of needing a revision surgery than anyone else on the other sides of the spectrum. So what we come to is that person fits in the Goldilocks theory. You have the just right amount of physical activity, exercise, being mobile, moving, doing activities. You don't want to do nothing. You don't want to be sedentary. That's not good for your joint and your knee pain and your health. You don't want to do super intense, or you can, but realize that with that, at some point, you start to see increased risks of having that joint pain, having joint problems that aren't positive and aren't usually wanted, of course. All right, so that's the Goldilocks theory. Another place, there's probably a couple of places where this same idea can apply, but another place I like to apply it is with your rehab after knee replacement surgery. So when you're rehabbing from knee replacement surgery, we actually have to stress your knee joint. We have to do exercise. We have to do range of motion activities. We have to build your strength back up. We are putting stress on that joint, but we're doing it in a way that is, again, the just right amount. We're progressively doing it, nice and slow, increasing over time as your knee tolerates, as your body tolerates. If we do nothing after surgery, then you're going to be stiff, you're going to have swelling, you're going to have pain, you're going to have buildup of scar tissue and poor mobility and range of motion. You're probably going to have a negative outcome from surgery. You're not going to be pleased with your result and with your outcome. On the same end, on the other side of the spectrum, again, if you go super intense, all out, high intensity all the time, and don't give yourself and your body recovery time to adapt to exercise and activity, then you're going to have flare-ups, you're going to have pain, you're going to have intense swelling, and you're just going to set yourself back and probably not be able to maintain that for a prolonged rehab and recovery. You probably might even fall from here and then fall right back over to being sedentary and not doing very much because you have so much pain and discomfort. So again, you want to find that just right. You want to be physically active, you want to exercise, you want to do the range of motion, the physical therapy, enough to stress the body, enough to make those improvements. It might be a little uncomfortable. It might, there's going to be pain, there's going to be some discomfort, but we're not going to, beat ourselves up and kill ourselves to the point where we have a quote unquote flare up and we have this pain and intense pain, stiffness and swelling that sets us backwards and, one step forward, 3 steps back. So it's that just right amount, kind of progressively increasing it with the help of your physical therapist, with the help of your surgeon, slowly over time. So those are the 2 main areas where I like to apply what I call the Goldilocks theory, finding that just right amount. So hopefully this gives you some helpful insight if you're someone who is preparing for knee replacement surgery, if you're just someone with joint pain and knee pain, if you're someone who is recovering and is rehabbing after knee replacement surgery as well. Thank you very much for watching, everyone. This has been the Need to Know Show. Take care, and I'll talk to you all soon.